Hi, students. I thought I would go through your modifier worksheet just to explain a few things. So let's go ahead and start off with number one. A few of you had that incorrect, but we have Mr. Jones admitted to the hospital by the ortho surgeon for hip pain. They provide initial hospital visit during which is determined that there is a fractured hip. Mr. Jones taken later that day to the OR where Dr. Ortho performs the procedure to repair the hip. Which modifier would you use for the hospital visit? Okay, so if you look at these, keep in mind that a doctor pretty much when they do surgery, they can, use that initial hospital surgery code, but they usually do it before the global, because they're prepping for surgery. They have the patient come in 3 days, 4 days, whatever before surgery, and they're allowed to charge for that. But they can't charge that initial right before surgery because it's included in the global. So there's a modifier that states 57, which is decision for surgery. So you would put this on the initial H&P hospital visit. That way it gets paid for. And it's telling the insurance company, hey, it's okay. This is the first time I've seen the patient. I had to do a history. I don't know much about that patient. I want to get paid for that hospital visit. Okay, so number two, that's going to be 25. So let's just going to look between 24, 25. I think some of you put 24 on number one. Once again, this is during post-operative. Okay, so we can't use 24 for number one. So with number two, let's go to 25 and let's explain it here. Mrs. Smith presented to the office for an office visit for upper respiratory infection. The physician examines the patient, prescribes antibiotics. Physician noticed the patient has a suspicious looking mole. The physician examined the mole and determined that it should be removed. So the mole was removed during the same office visit. Physician bills both an E&M code and a procedure code. So to get that E&M code, okay, we go back to that global again. You are not allowed to charge an E&M and a procedure on the same day because of the global. So, but this is the difference here. They're coming in for a respiratory infection and they're taking a mole off. So for the E&M code, you're going to put a 25 on the E&M code, and you're going to make sure that respiratory infection diagnosed matches up with that E&M code, and then you're going to have the mole removal, so the CPT code for removal of the mole, and then the diagnosis code is going to be lesion or whatever it ends up being. So that's why you want a 25. It's the same day of a procedure. It's significant. It's a different E&M by that same physician. So hopefully that makes a little bit more sense to everyone. Number three was great. I think everybody had 32. Number four, multiple surgeries performed during the same operative session is 51. Couple of different things. That first surgery is not going to have a modifier on it. Any additional surgeries is going to have a 51. And one thing to keep in mind, usually how it gets billed to the insurance company, you have that 51 on second and third surgeries, and it's discounted usually 50%. The reason is because they're already in the operative room. You can't charge 100% for each surgery. Okay, so number five, we have a 26 professional component. Right there, I have professional component. Now, technical component, that's a TC. Number seven looked really good. Everybody did put 90 down. 58. This one here, some of you, I think multiple stage, you thought maybe a 51 for multiple procedures. That's not what we're looking at. This is going to be a 58. It is when it's necessary to indicate that the procedure or service during the postoperative period was planned, which right here, second stage of the procedure is done in a scheduled time frame of a multiple stage procedure. So different things that here possibly if they did maybe a mastectomy and then they're saying we're going to have you come back in a month and we're going to do a reconstruction of that mastectomy area. That is a stage procedure. They know that patient's coming back in again. So if there's any question on that, just contact me. And then 24 is unrelated office visit during the global period. And if you read 24, it says right in there post-operative. It's going to be during the global. It's unrelated. And keep in mind another thing that I really want you to pay attention to. 24 and 25 modifier. These have to go on an E&M code. You never put those on a surgery code. Your other codes here, just a little 76, 77, 78, those go on a surgical procedure, not an E&M. So it's really close or really important that you look at your back part of your Appendix A, read through the modifiers descriptions, read through their examples. It really will help make sense of things. Modifier 59 is number 10. Everybody did pretty well with that one. I can tell you one thing, a lot of times insurance companies, it's overused. So yes, you can use 59. To me, 59 is when you're trying to get both procedures paid for at 100%. So instead of using a 51, you're trying to use to get full payment on each. So they'll put a modifier 59 on it. All right, if anybody has any questions, you can re-listen to this video. Hopefully it explained a few things out for you a little more clearer. If you still have further questions, feel free to contact me.